My name is Agitiara from TDR Global Asia, and I am thrilled to be your host for today's session. Today, we have the unique opportunity to explore the transformative potential of crowdsourcing in health research and solutions. Crowdsourcing can empower communities, accelerate innovations, and break down barriers in healthcare by engaging a diverse array of voices and talents. So today we are very privileged to have with us here a leading expert in this field, Dr. Joe Tucker from TDR and also a part of social entrepreneurship to Spur Health or SESH Global and SIHI China, who will share his invaluable insights into how crowdsourcing can revolutionize the way we approach health challenges. Dr. Joe Tucker is a renowned figure in medical research with numerous contributions to public health and innovative approaches to disease preventions, especially HIV and STIs. His work emphasized the importance of community involvement and open collaborations to drive significant advancement in health solutions and research, of course. Before we begin, I'd like to remind everyone that this event will be recorded for future references, and we encourage active participations from you guys. So feel free to share your thoughts and questions through our chat platform, or simply raise your hands during the designated Q&A section. Now, without further ado, please join me in welcoming Dr. Joe Tucker. Dr. Joe, how are you today?
Good afternoon, Aji. I'm well, thanks. How are you? Thanks
I'm
for the
fine.
nice introduction.
Yeah. So, Doctor, thank you for joining us today. We're very eager to hear your expert perspective on how crowdsourcing can drive innovations and solutions in health and health research. The floor is yours, Doctor.
Thanks. And I want to make sure you can see this on slide view, and there's it. Can you also see the text at the bottom?
Yes.
Yeah, you're all good. Okay, great. Thanks again for the invitation. It's great to see folks. And today we'll be talking about crowdsourcing, as Aji mentioned, and how can we spark innovation and meaningful group collaboration. And this is a really, oops, it says my screen sharing is paused. Can you guys still see the screen?
Yes, we can see the first screen.
Okay. I don't know it's saying that, but I think if it gets stuck, just let me know. Does it say outline now?
No, it's still on the cover, the enhancing solutions through crowdsourcing.
Hold on a sec. I'm gonna try and reshare. How does this look?
Yes, the text
Okay.
is also
And then it's going forward. Yeah.
it's going forward, Doctor. Good.
Okay. So I'm going to talk about crowdsourcing. I'm going to keep it brief. I'll keep it very brief. And at half past or so, happy to answer questions. And yeah. So I'll talk a little bit about what is crowdsourcing, how do we define it, how can it be used in different contexts, and then I'll talk a little bit about crowdsourcing as a way to engage local communities. How can crowdsourcing introduce new ways of working in partnership with local people? And then I'll talk a little bit about how crowdsourcing can be used for intervention development. And by this, I'm thinking about public health interventions, and when we're developing new things, how can we use crowdsourcing processes? And then finally, I'll talk a little bit about consensus statements and guidelines. How can crowdsourcing be used to develop consensus? So first, what is crowdsourcing? In some ways, it's thinking about collective efforts and collective action, and then sharing back the results of that collective action with the community. And so there's sort of an individual part, the individual task that an individual person responds to or contributes. And then the collective part, how does the sum be more than just a collection of individual efforts? How can we find synergies and collective understanding? And really, if we're thinking about developing new health services, oftentimes new health services rely on conventional methods, limited community engagement, being very sort of expert-driven, top-down, and using conventional communications sort of pre-digital. And so even though it's not meant to be a bunch of old white men making decisions about health services, oftentimes it is like old white men who end up making these important decisions. So like why couldn't we have greater ownership in a grounds up way and think about more innovative communications, having things really capturing insights and wisdom from local communities and expanding community engagement. And this suggests the need for a more community engaged, grounds up and innovative approach. And so crowdsourcing, I know crowdsourcing has been defined in many different ways. This is the definition from the WHO Practical Guide. When a group of people attempt to solve all or part of a problem and then share selected solutions back with the public. So there's really kind of two parts to this. The first part is about collective intelligence and how can we have a group of people solve a problem. And you need to understand the problem could also be a smaller one that maybe it's individuals coming up with solutions to specific tasks. Sometimes it's a contest where the problem is given to a larger group of people and the best solutions are selected. So the first part really is about collective intelligence. And then the second part is about open access. How can we make these good ideas more widely available? How can we either implement them or evaluate them? So where have you seen crowdsourcing approaches in your country? Feel free to put your answer into the chat box. Just going to pause here for a moment. Given the definition that we just mentioned, does anyone have some examples of crowdsourcing? It could be related to health or it could be unrelated to health. Melita's saying it's a new concept in Indonesia, and I agree. I think there's lots of just the concept itself is unfamiliar to many people, especially researchers and health researchers. Yeah. Yusuf is saying a charity concert for HIV shelter. So Yusuf, is the idea, just want to make sure I understand it right, is the idea that you raised money, basically there was an HIV shelter, you collected money and the individual donations from people were pooled and then given to help an HIV shelter. Is that right? Yeah. So yes, I think that's definitely part of crowdsourcing. There's a whole separate concept called crowdfunding, which is sort of micro donations. I do think that's very much related. That's not going to be the focus of what I'm talking about today, but it does, in terms of like the definition that we just showed, it very much is having a group solve a problem and then sharing back solutions with the community. So I think it's definitely a good thought. So keep going here. A couple more examples. Mutual aid. Some of you will have been familiar with this from COVID, where members of a local community work together to help each other, solving problems directly and generating community resources. And there were many mutual aid groups established during lockdowns to help older adults, to build support for marginalized groups, and allow people to directly help each other. Another example of crowdsourcing from COVID was We versus Virus. This is an online hackathon in Germany where 26,000 people created a total of 1,400 project ideas. And later they found that this increased trust in the government response, and several ideas were implemented by the German government. Going closer to Indonesia, I know some of you are involved in dengue research, and our team, in partnership with the World Mosquito Program, did a crowdsourcing project in Sri Lanka, and we organized an open call to solicit strategies for community-led mosquito distribution and for text-free instructions. And basically, this is the World Mosquito Program has a Wolbachia-based method for reducing. It's the science is really exciting, and WMP has a strategy where instead of you basically release mosquitoes into the community with a specific that have Wolbachia in them, and the community engagement becomes really essential as part of this strategy. And so they noticed that the instructions were often kind of laborious, and especially in places where there are a bunch of different local languages and literacy levels, it would be helpful to have a text-free instruction manual. And you can see on the right here, the winning submission, the totally text-free one in the top left, and then a few other submissions with sort of minimal text. And there were also some great community-led mosquito distribution strategies that were identified. In the end, there were 73 submissions received, and several of them were identified as high quality by independent judges and then used in the World Mosquito Program. And this was published in the Journal of Infectious Diseases last year. And I think dengue, because of the importance of community engagement, using crowdsourcing for dengue programs and thinking about how this could be relevant would be, this is another nice example of crowdsourcing in a sort of dengue context. And then other examples of crowdsourcing, so there are open calls, contests, competitions, challenges, open solicitations and promotion to the public for challenge submissions. This is basically what I was talking about with the dengue example. You have the public come up with ideas, then they're evaluated. There's the best top-ranked solutions are then either implemented or shared back with the community. And this has been used to develop logos, images, videos to accelerate pharmaceutical drug development. We've also used design-a-thons. I'll talk a little bit more about what these are in a few minutes. And then digital systems like websites or portals that allow individuals to solve a problem. There's more information. Our team organized a systematic review a few years ago. The definitions are a little bit old, but these are just a few examples of crowdsourcing. This is one of my favorite examples of crowdsourcing at a 1906 county fair in England, a group of individuals was asked to guess the weight of an ox, and the median estimate of the crowd was accurate to within 1% of the actual weight and better than any estimate from agricultural experts. So this is underlining the potential for crowd wisdom. And what are some of the key elements in crowdsourcing? It's important to have a diversity of opinion, where each person should have private information, even if it's just an eccentric interpretation of the known facts. Independence, so people's opinions aren't determined by the opinions of those around them. Decentralization, that people are able to draw on local knowledge, and then aggregation, having a mechanism for turning private judgments into a collective decision. And in China, there's the 8 immortals crossing the sea, where individually they wouldn't be able to cross the sea, but if they use their unique talents and strengths, they can cross the sea together. So what are the, and to kind of go into more detail with one example of crowdsourcing, the open call, this is similar to what we did with the dengue example, where first we organized a community steering group. This is a group of local community leaders, health professionals. They established the contest rules and the open call for entries. Then the second part is engaging the community to contribute. This clarifies the contest for community members and provides feedback on submissions. It could be in person, it could be online, and then evaluate contributions. It could be a crowd-based judging system. It could be an expert-based judging system. And then recognizing finalists, social media and in-person announcements of finalists. And then finally, sharing solutions and implementing. These are a few sort of key stages in the open call process. So now I'll talk a little bit about community engagement. Crowdsourcing can be used to enhance community engagement. And by community engagement, I mean an iterative bi-directional dialogue between researchers and community members. So why would we want to think about crowdsourcing for community engagement? It's a more grounds-up approach that builds solutions from the ground up. It's an inclusive process that can engage marginalized groups. It can distribute power more broadly within communities instead of relying on experts alone. And it may enhance trust and strengthen relationships between researchers and community members. And so if you look at the literature on crowdsourcing for community engagement, crowdsourcing has been used to listen to community perspectives prior to clinical trials, to enhance participant recruitment and refine survey instruments. It's been used for more robust community engagement, or found to be more robust compared to community advisory boards and similar approaches. And the references below provide a few examples of crowdsourcing for community engagement in the context of clinical trials. Co-creation groups are another example of crowdsourcing for community engagement. And here you have small groups of end users, health professionals, and other people who solve problems. This is inspired by community-based participatory research. Typically, these are paid with a very specific scope of work, and they've been used to inform clinical trials, study design, and consent procedures. Next, I'd like to talk briefly about intervention development. So why would crowdsourcing be relevant to designing interventions? This can incorporate end user preferences and styles and cultures. You've probably heard the mantra, nothing about us without us. This can build local horizontal partnerships that increase the likelihood of sustainability. This can be very low cost compared to conventional processes and more community engaged, as we just mentioned. There are also designathons. So designathons are a multi-step process that include preparation, and that could be co-creation, then followed by a phase of intense collaboration. Oftentimes this is like a 48 to 72 hour event, and then some kind of follow-up. This designathon can encourage multidisciplinary collaboration, and they've been used to co-create mobile phone applications for MSM. And on the right here, you can see an example of one of our design-a-thons focused on MSM sexual health. There's a much broader evidence base supporting crowdsourcing open calls. These are some of the references, but you can see the crowd contribution. Sometimes it's images, sometimes it's videos or concepts. The purpose are many of these have been STD and HIV focused, and then they've been evaluated using trials and qualitative research. And then finally, I want to touch briefly on consensus processes. Why would we use crowdsourcing for consensus development? This can incorporate a larger number of perspectives, including from non-experts, people living with disease, and others. It can be a more inclusive approach than conventional guideline development and a structured way to aggregate wisdom from multiple individuals. This can be transparent, fair, and sort of more open science way to achieve consensus. These are a few examples of using crowdsourcing for consensus development in partnership with HRP. Our London School team developed a sexual and reproductive health survey instrument, and that's now become this sort of standard HRP survey. And that's the top one here, led by Dr. Anay Pakri and Don Wu and Megan Srinivas. And then in the social innovation realm, we used a crowdsourcing approach to develop a research checklist on social innovation that ended up informing a social innovation monitoring and evaluation framework. We did a similar project focused on crowdsourcing itself. And then in partnership with the hepatitis program at the WHO, we solicited stories about hepatitis testing. So these all used crowdsourcing approaches, and this is to kind of give an example of how it worked in terms of the guideline development. The first part was an open call, just like I mentioned before, and then finalists were invited to participate in the hackathon, sort of this more intensive phase. And then after the hackathon, there was a draft survey that was developed, and that went through an adapted Delphi process to achieve the final sort of consensus survey instrument. There are a number of open access resources. There's a crowdsourcing practical guide that's on the TDR website. Nesta has a collective intelligence design playbook that's also useful. There are a few reviews that are mentioned here. And then in the social innovation realm, the M&E framework, I think, is also helpful if you're thinking about research on social innovations. We have a bunch of crowdsourcing things that are cooking related to equity and research mentorship, HPV, HBV, HIV and PrEP, hypertension and stroke screening. That project is actually about music for health. So we're soliciting songs to increase awareness of hypertension among young people, and then stroke prevention among the caregivers, among the parents and grandparents. And then finally, mentorship. Our team is very interested in new methods for mentorship and how do we improve mentorship. So obviously, crowdsourcing is not a panacea. There are lots of ethical considerations that should be examined. You need to think carefully about logistics. Some of you may have heard of the Bodie McBoatface example, where there was an open call for ideas about the name of this boat in the UK, and the voting and the submitting of ideas and judging were combined together. And so very quickly, the top ranked idea was Bodie McBoatface. And so the British government had to make a difficult decision about, do they honor the wishes of the crowd and name this public ship Bodie McBoatface, or how to deal with it. And then you also need to think carefully about sharing back with the public. So crowdsourcing is not only about collective wisdom, it's really about sharing back with the local community. So that's a really important consideration. I'd like to thank our research team. The website is seshglobal.org. Our funders, the United States National Institutes of Health, the Bill and Melinda Gates Foundation, TDR and WHO. Thanks to the SIHI Indonesia team and Dr. Yodi and Kamang and Aggie, and the TDR Global team in Indonesia. I have a short video. If it's okay, can I show the short video?
Of course, of
Is that
course.
okay? Okay. Let me just pull it up.
This video introduces a...
Okay, I'm gonna go share and make sure that this is shared with video, optimized for video clip. Can you see the screen now?
Yes, we can see the screen now.
Okay. And when the audio starts, if you can't hear it, let me know.
Practical guide on crowdsourcing that was created by the WHO TDR Social Innovation and Health Initiative. Crowdsourcing. What is it? How can it be used to benefit people's health? What kinds of problems can it solve? Let's first define what crowdsourcing is. Crowdsourcing. Having a group of individuals solve a problem and then share the solution with the public. This method of generating ideas has been used before to develop health interventions, inform health policy, and spur community engagement. Crowdsourcing contests that are used to inform health have major advantages over conventional approaches. In particular, here are 5 benefits of using crowdsourcing. 1. It expands individual and group engagement from communities that otherwise may not have a voice. 2. It creates an obligation for the contest holders to give back to the group and/or public that facilitated the whole process. 3. It shifts the burden of work to a larger group of individuals, allowing big tasks to be broken down into smaller components. 4. It taps into existing social networks, including the massive communities that exist online. And 5. It significantly lowers costs compared to other approaches, saving both time and money. There are 6 steps to take in order to facilitate a crowdsourcing contest. Each of these steps is crucial in ensuring that your contest is effective and runs smoothly. First, assess the appropriateness of a challenge contest. Before we start, there are a few specific settings where crowdsourcing may be more useful. For example, there have been more crowdsourcing contests related to HIV and sexual health compared to other fields. Second, organize a community steering committee. This group establishes contest rules, clarifies the contest purpose, and selects an appropriate prize structure. It is important that the steering committee includes the following: a diversity of opinions which could encompass individuals such as local community members, health professionals, community-based organization leaders, and private sector leaders. Individuals with direct personal experience with the problem, and at least one individual with experience organizing contests to facilitate the planning process. Third, engage the community to contribute. By promoting the contest and publicizing its cause, we are able to receive a larger and more thoughtful pool of submissions. Engagement can look like a few different things. It could be an open call for images promoting sexual health on social media platforms, or it could also be in-person events on campus, including interactive feedback sessions. Fourth, receive and evaluate submissions. By separating the judges into multiple phases, each with a different audience of judges, submissions are screened and then evaluated by a panel of expert and non-expert judges. Fifth, recognize the finalists. Exceptional submissions are recognized through announcements, social media, and ceremonies. Oftentimes, this formal recognition is more important to participants than the prizes. In our image contest to solicit images promoting sexual health, we celebrated the submissions and community contributions with an award ceremony on World AIDS Day in 2014, in addition to a social media announcement. Sixth, share solutions and implement the ideas. Once finalists are selected, the final stage involves sharing and implementing the idea. This can mean spurring a larger public campaign, contributing to a research study, or creating an open access resource. After our image contest was over, we shared the strongest submissions with local officials. This led to the province paying for the rights to the image and scaling it up across 300 STD clinics in 22 cities in Guangdong province. Crowdsourcing contests could be an integral part of the future of public health. It only takes 6 simple steps to organize a crowdsourcing contest. First, assess the appropriateness of a challenge contest. Second, organize a community steering committee. Third, engage the community to contribute. Fourth, receive and evaluate entries. 5, recognize the finalists. And 6, share solutions and implement the ideas. Crowdsourcing contests could be an integral part of the future of public health. It has the potential to revolutionize the way we gather ideas and move them forward. We would like to give a special thanks to the SESH and SIHI Hub at WHO TDR that helped to create this practical guide.
Great. I think I heard a recording started, but maybe that was someone else. But if you Great. Happy to take any questions.
Well, thank you so much, Joe. So everyone, if you have any questions, this is your chance to engage directly with Dr. Joe Tucker and maybe delve deeper into the topics discussed. Oh, we have one questions already, Joe, in the chat room from Malida Magista. If I may read it to everyone. Thanks for the insight, Joe. One of the primary challenges in initiating a crowdsourcing effort, especially when it is relatively unfamiliar, is securing sufficient participation. As we know, a greater number of ideas and innovations leads to richer insights. Based on your experiences, how can we effectively attract attentions and encourage participation in crowdsourcing? Is offering prizes to boost participation a good strategy, given that in crowdsourcing there is no concept of a best or worst idea?
Thanks, Melita. That's a great question. And I think there's a couple of different points about getting more participation in a crowdsourcing open call. One part of this is to think about what is your ask? Like, is the thing that you're asking people to do reasonable in sort of the time period that you're allocating to them? Because one way, like at the end of the day, you may want a mobile app or like a component of a public health intervention. But in order to get there, it may be more like having different phases of a contest. And so having, breaking up the big problem of an app into smaller problems that teams or individuals could contribute to. And so like if it's an app, maybe you'd have one category focused on communications and like branding, one category that's more the technical part. The other part of this is like individual versus team contributions, that oftentimes teams can do things that individuals can't. And so encouraging teams of people to work together can be helpful. And then also iteratively defining your ask with the community members. So if you have end users who are part of your steering committee, then they could help you to say, oh, wait a second, we're being too ambitious. We need to kind of make our the ask for this somewhat more modest. And I think your point about how can we, is it offering prizes to boost participation a good strategy? Prizes are definitely helpful. Sometimes it's I'm surprised that things like you would think that monetary prizes are the best. It really depends on the context. Mentorship and having people see their ideas being implemented can also be really attractive prizes to many people. If the whole purpose of the project is to do something or to do research, then having prizes that are specifically for implementation or specifically to support a pilot research project, that can be helpful. And then, in terms of engagement and like what motivates people to participate, ultimately, I think having a question that's relevant to your audience. So if you're talking about stroke, like looking at people who have a greater risk of stroke or people who have high blood pressure may help you to identify more people who are interested in the topic. Collaborating with other community-based organizations would be another way to kind of think about how to expand participation. Melita, does that make sense? Did I answer? Is that fair? Yeah, okay. And then the next question is from Dedi, who asks, could you please elaborate on the ethical considerations you mentioned? As we collect ideas and innovations from people, what type of consent should we take into account? This is a really great question because it often comes up, and we wrote a whole paper specifically about this topic. I'm going to put the paper into the chat box, but there's a whole bunch of, oops, hold on a sec. This is a paper on the ethics of crowdsourcing. So basically, in terms of ethical considerations, you when you're organizing a crowdsourcing open call, you're getting like a whole bunch of people to spend a small amount of time, or to spend different amounts of time on the open call. And one simple kind of way to make sure, like, one potential risk is that if you're getting all of these people to help, like say it's dengue, you're getting them all to think about dengue and contribute to dengue, but then they don't get money. They don't get, is this just unpaid work? Is it unfair for participants? That's a question that we really think carefully about. And on the survey, like when we send out an open call, we'll actually ask people, how long did you spend on this? Like, did you spend half an hour? Did you spend like days? And that can give us a sense of like a little bit of a sense of how much effort was put into these. And this is also this is why you have a steering committee as well, that they can help you to be accountable to your participants and say, well, there were so many people who contributed to this. Shouldn't we give everyone a certificate? Or like what's the right balance in terms of giving back? And the other point is like if you're thinking about dengue in Sri Lanka or in Indonesia, like this is a really important public health problem. So like for an individual or for a family to kind of think more about dengue, that in and of itself is like a good thing, you know, like having people think a little bit more um, about their ecosystem and about infectious diseases. Like dengue is only spreading. So I think that's another thing to consider just in terms of like, is the juice worth the squeeze, or is the prize structure set up fair? And then to your second point, Dedi, what type of consent should we use? Like, is this, and I think this goes back to a very important question when you're setting up a crowdsourcing open call. Is your crowdsourcing open call a research study, or is it a program? And if it's a research study and the primary objective is like, I want to, you know, create things that'll become evaluated in a subsequent trial, if it's more about research, and then you really need to get informed consent for participants and as a research study. On the other hand, if it's a program, and we've done several programs as well, like with TDR, we wanted mentorship, you know, for like tips on mentorship and practical strategies to enhance mentorship in low and middle income countries. So for that, it's not like it's a research study. It's more of a program where the focus is capacity building and helping research. In that case, I that may not need individual informed consent. You'd still, even if it's not a study, we still have some standard language that's sort of like, I consent to give my submission, and then that also clarifies what happens afterwards. That is there are the images or videos going to be shared with others? Like what expectations? Um, and then the other part about consent. So you want to follow your institution's guidelines, but if you're not sure, you can always talk to your local institutional review board and run through this with them. That can help to clarify what the roles are. But I'm happy to share consent forms and descriptions of IRB stuff that we've used for other crowdsourcing open calls if it's helpful. Let's see. Oops.
Joe, can you hear us? Dr. Joe? Well, maybe Dr. Joe has slight technical problem.
Yeah, sorry about that. I'm back.
Thank you, doctor.
Was there another question in the chat?
We have plenty of questions actually from our very excited participants. From Florisma Arista, she asked, in your opinion, why are crowdsourcing and hackathons more popular in the IT sectors, but not really in health settings?
Good question. And I think with hackathons specifically, they were almost born out of tech, that like the tech world wanted to kind of rapidly iterate and And there's, within crowdsourcing itself, there are many open calls and contests that are either entirely online or kind of focus more on the digital world. And um, our our experience comparing the online crowdsourcing to in-person, a lot of times you'll get better ideas if you do in-person events and you actually meet people. And we did an open call a few years ago where like the people who had participated in an in-person workshop, the mean score of those ideas was better than the people who had only seen it online. And it could be that this gave people more support, that they gave them networks. But I think the in-person part is really important, especially when we know that there are these big digital divides, that lots of people aren't online. Um, and and the other part, I think this gets back to attention and social innovation between having having the kind of focus be on tech or like a new technology versus focusing on a community strength. And sometimes it is the same. Sometimes the community strength is the tech, and I think it can work really well together. But oftentimes the technology part is not coming from a community need, and it's sort of different. But I think there's a lot of room for partnership between the digital world and the in-person world. I don't see it as a contradiction. It's more just thinking of creatively about how you bring together these partners. There are lots of digital tech, entrepreneurs who are really interested in helping people. There are lots of communities who have great ideas, who, their social innovations and community wisdom could be relevant to technological development. So it's just a matter of like connecting the dots, really. Good question. Does that make sense?
Well, we have one more questions, Dr. Joe, from Mutiara Shintanoviar. Dr. Joe, thank you very much for the explanation you provided. Very interesting and makes me want to confirm one thing. Our researchers once gathered ideas and opinions from X or Twitter users. The topic was in social areas. It was about how much lecturers' wages are in Indonesia. They also gathered their opinions about, are you think the wages received by lecturers in Indonesia are worthy? And the results are quite amazing. They managed to collect tens of thousands of responses from ex-users. I wonder, is this called crowdsourcing? And if we take society's opinion on more sensitive topics related to gender preferences, or other things, will this method clash with ethics? Thank you so much, Doctor.
Thank you. And this is a really interesting question, because I think X and what you describe, I think, is sort of the first part. I would say that's part one of crowdsourcing, the kind of collective intelligence that you can have a whole bunch of ideas that are put onto X, and that can be valuable. I think from my perspective, for it to really be crowdsourcing, you would then need to either share that back with Twitter and say, here, thank you so much, here's what we found. Or if there was a manuscript that came out of it, or something that's like a public good, a way to share back this knowledge with the broader group, since it was the broader group that sort of like contributed to it. If you could do that second kind of open access step, then I think that would be a nice example of crowdsourcing. And then in terms of the second part of the question about sexual minorities, I think this is where you really need to be careful and plan in advance that it would be possible to have a survey instrument where you collect information about, for example, what are the preferred ways of what are the right pronouns to use on forms, on socio-demographic forms. and get suggestions or ideas from a group of individuals. At the same time, you wouldn't want to combine the solicitation of ideas and the judging process because, for example, if you had like a pronoun that was inappropriate or or just not something that the public should see, then and people were already voting on it, then that could be a big disaster. But separating out the solicitation of ideas and the judging is simple and one easy way to make sure that that you're doing something that's productive. And then the other part is really working in partnership with local communities because um, there may be other issues about identifiability that if you end up talking with local sexual minorities or local people, they would say, "Oh, this is a good idea, but you need to organize it this way." Um, and I see Kamang has also put a session evaluation form. So for everyone, please click on the Google form, fill it out. SIHI, the TDR Global Group and SIHI in Indonesia, they're always very keen on iteratively improving the monthly webinar series.
Yes, thank you very much, Dr. Joe. Yeah, we have a form for evaluation and insight. Oh, there's one more response from Sinta. Dr. Joe, how do we manage that the information we collected from social media is valid proof and responsible as the first step of crowdsourcing, gathering the ideas as you mentioned before?
I love this question. This is a great question. And I was just talking to like I have two sons, and it's sort of like the question is like, are they doing their homework? Are they messing around? Like, are we going to get ideas for this crowdsourcing open call that are like genuine, like good ideas, or just people messing around? And I think social media is full of spoofs and bots, and like it's this kind of wild world of lots of different ideas, right? So within this wild world, how do you find things that are like meaningful and generated by a human and actually rigorous? And I think there's a whole there's like a whole science of like when someone fills out an online survey, how do you tell if it's a human versus a bot? And if anyone's interested, a few colleagues and I are thinking about this in a paper right now. But I think ultimately there's some things that you can do as you organize the crowdsourcing open call that can make it more likely to have good sort of rigorous ideas. The other part of this is that if we really want to engage a large community of people and like a broad public, then I think we should also see like, say you have, we've had contests before that have gotten 400 submissions, but only 200 of them were eligible. And is it that, and in some ways, like we're reaching a very broad group of people, and I think that's good. Part of this is about having information that's infographics and ways of connecting with people that are broader. In some ways, the messing around, I think, is a good thing because it's demonstrating that we're going beyond the usual suspects and getting a broader group of people interested in these topics. In other ways, at the same time, ultimately, we want really good ideas and I think ultimately they're not mutually exclusive. In other words, you can have you can have people who are messing around or it's not rigorous. But in the same open call, you can also get higher quality ideas that are worthy of being iterated and further developing. Um, really good question. Does that make sense, Mutiara? Yeah. Okay. Good question.
Okay, thank you so much, Mutiara Sinta Noviar, for the amazing questions. But due to the time constraint and limits, we're very sorry. We need to conclude today's event. Thank you so much, Dr. Joe Tucker, for taking the time to answer our questions. We truly appreciate your insight and expertise. And I'd like to extend our gratitude on behalf of TDR Global Asia to everyone who participated. Your engagement today is very vital to advancing the conversation on crowdsourcing, especially in health solutions. So before we close the session, we would graciously ask the participants to open their camera and take a picture with us for the remembrance of the session. So yeah.
I'm so curious with Heru Super. It makes me think that like Heru is like a video. It's like I love it. Heru.
Yeah, Mr. Heru Super, Dr. Heru, maybe. It's so cool that you have a 3D avatar on Zoom. We might need to ask how you create it. It will be very fun and useful on webinars, I think. So everyone, my team will take a screenshot and take a photo. Please smile. 1, 2, 3, and one more. 1, 2, 3. Okay, thank you so much, everyone. On behalf of the team and TDR for Research on Disease of Poverty, TDR Global Asia, thank you for joining us today. We look forward to seeing how each of you will contribute to enhancing health solutions through crowdsourcing after this. Thank you so much, Dr. Joe Tucker. Stay safe, stay inspired, and have a wonderful day. Goodbye.
Bye-bye. Take care.
Thank you. Thank you, Joe. Thank you, everyone.
Thank you so much.